Hello everyone, welcome back to my YouTube channel. Today we're going to talk about CNA Test-Taking Skills, Part 1. I know I've been off for some time now, but I'm back again. Before doing this video, I discovered that some students are having problem with their written exams. Most times they know what they want or they know the right answer, but when they're faced with two similar options, they find it difficult to make the right choice. So I'm just going to do this few minutes video, and I think that will help, with answering questions. So the first thing we're going to talk about is the goal of these test-taking techniques. The goal of test-taking technique is to prepare students ready to apply their knowledge and build new skills when they are responding to questions. There are 4 crucial techniques or aids in identifying the right response to questions. First of all, you want to know your responsibilities as a nurse aide. Secondly, you want to know about Maslow hierarchy of needs. You want to maintain resident safety, and you want to maintain therapeutic communication. If you have an idea of these 4 things and you incorporate it in your questions or when you are answering questions, I think you will be able to pass your test. Now, what are your duties, your responsibilities as a nurse aide? A nurse aide is a person who works under the direction of a licensed nurse, maybe LVN or RN, to provide nursing or nursing-related services to the resident. As a nurse aide, you have job responsibilities towards your residents, the facility, and staff also. Responsibilities, your responsibility towards your residents is mainly providing basic care. ADLs, which is activities of daily living. You are responsible for ambulating your resident, walking your resident, sitting them down, lying them down, getting them up. Grooming. This covers all personal hygiene tasks such as shaving, bathing, brushing teeth, hair care, nail care, toileting, dressing, and feeding. These are basic care that we provide to the resident. We monitor resident health. Yes, we are responsible for monitoring the resident health and informing the nurses if there is any changes. When you walk into your patient room and your patient is shivering, you touch the person, you feel that the person is having high temperature. That is fever right there. You want to tell your nurse. Your nurse might ask you, okay, go and take vital signs and let me know. This is part of monitoring the resident health. Remember that the nurse aide, we are the ears, the eyes, the nose of the nurses. Our observation and what we report to the nurses matters a lot. The nurses are responsible of taking and precisely recording vital signs, which are the blood pressure, temperature, pulse, respiratory rate, and then pain. Remember, we spend more time with these residents, more than the nurses. So most times, the patients report to us that they are having pain. Are we supposed to give them pain medication? I hope you will say no to that. No, but we report to the nurse that the patient is having pain. Now, let's take one question. Which of these following is a job task performed by the nurse aide? Number 1 or A, participating in resident care planning conference, taking a telephone order from a physician, giving medication to assigned residents, changing sterile wound dressing. I hope you will pick the correct answer. But before then, let's take these options one after the other. Let's assume you don't know the correct answer to this question. But ask yourself, are you supposed to do wound dressing, especially the sterile wound dressing? No. Are you supposed to give medications to your residents? The answer is no. Are you supposed to take telephone order from the doctor? Of course, the answer is no. If you don't know whether you're supposed to participate in resident care planning conference or not, but you already know these 3, B, C, D, that you are not supposed to. So why won't you pick answer number A, even if you don't know what that means? I mean, this is part of the test-taking skill, like elimination method. But yes, the answer is A, participating in resident care planning conference. Remember, we are ears and eyes and nose of the nurses. Miss Jones, we spend more time with Miss Jones. If Miss Jones was unable to feed herself a few weeks ago, but today she was able to feed herself, it is an improvement. We have to tell the nurses. We are telling the nurses so that they can adjust the care plan. They can document and improvement on these residents. By so doing, we are participating in their care planning. Even though they might not call you to come and sit down with the other healthcare team members in care planning meetings, but our information, our observation and reporting is part of what they are using in that care planning conference. Question number 2. A resident tells the nurse aide that she has pain down her arms and into the jaw, and that she feels nauseated. The nurse aide observed that the resident appears pale and is sweating. The nurse aide should check the resident arm and jaw for possible injury or bruising. Check the care plan to see if the resident is on heart attack precaution. Ask if the resident might have eaten something that has upset her stomach. Recognize the seriousness of the signs and observation and report immediately. What do you think is the answer to this question? Yes, I know B and C is out of the equation. Now we have A and D to think about. I hope you will get the correct answer. Now check the resident arm and jaw for possible injury or bruising, and recognizing the seriousness and reporting it to the nurse. Which one do you think is your responsibility? These 2. Yes, the answer is D. Checking the arm and the jaw is the nurse's responsibility, which is part of the assessment. The time the patient tells you, I'm having pain, I'm on my arms and jaw, you need to report to the nurse immediately. Now the nurse will now come and check that patient assessment. I hope you got this all right. So you need to know your responsibility, what you can do and what you cannot do. Your responsibility is not assessment. You are not supposed to assess the patient. All you need to do is report what the patient told you to the nurse. I hope I'm making sense with this explanation. The following are responsibilities of a nurse aide except helping a resident to bathe, administering a medication, keeping a resident's room tidy, applying an ice pack as ordered. Just know the word here, except. That's another thing that throws some people off. Meaning, every other option in this question is correct, but only one that is not correct. Now, what are the things you're supposed to do as a nurse aide? Are you supposed to bathe your resident? Yes or no? I guess yes. Are you supposed to give medication? No. Are you supposed to keep the resident room tidy? Yes. Are you supposed to apply ice pack? Listen here. Some people might say, but the nurses do this ice pack. I've never done it before. Where I used to work. Remember, you are working, maybe you are doing caregiver, and the agency allow you to give medication. Remember, even you are working as a caregiver, not even as a CNA. But yes, you are working according to what your agency wants you to do or what the family wants you to do. Ice pack, yes, you can do that. But to see this word as ordered, meaning the nurse asks you, please could you put ice pack on Miss Jones? So you can do that. But what you cannot do here is what? Giving medication. So the answer is B. These answers or the questions we just went over now is relating to what you can do as a CNA and what you cannot do. Remember, if you know your duties as a CNA, you are 50 to 60, if not 80% of your questions answered correctly. Now, another thing you need to consider when you are answering questions is knowing Maslow hierarchy of needs. Maslow hierarchy of needs have the physiological needs and safety needs on the lower level, meaning that we have to maintain these physiological needs followed by safety needs before we can get to social esteem and self-actualization needs. And when we talk about physiological needs, we are talking about nutrition, food, water, air, sleep, shelter, clothing. If somebody is not breathing, are you going to talk about intimacy, love to somebody who is struggling to breathe? I hope not. So we want to make sure at least the person is breathing, have food to eat before we can talk of something else. So if you have this in mind, now you will be able to answer most of the questions also correctly. Now, because physiological needs are necessary for survival, they have the highest priority, and that must be met first. Remember ABC, airway, breathing, and circulation. Look for those things that affect airway, breathing, and circulation. That should take priority when you are answering your questions. And strategies for priority questions. Many questions require you to use the knowledge of prioritization to answer them. When you're answering your questions, you will see some of those questions that has best option, essential, next, immediate, most appropriate, least appropriate, primary, vital, least likely, most likely. When you have such words in your question, one thing you should have in mind is that most of those questions, most of the options in that question might be correct, but they want you to choose either the best or the worst, least likely or most likely. So let's answer this question as an example. A resident is lying in bed and suddenly becomes short of breath. After calling for help, the nurse's following action should be short of breath, meaning the person is not breathing well. You have already called the nurse. Somebody come. The patient is not feeling well. What would be the next action? Ask the resident to take deep breaths. Take the resident vital sign. Raise the head of the bed. Elevate the resident's feet. Look at this question, short of breath. The person is struggling to breathe. You have called the nurse. What will you do next? In these options, it's good to ask the patient to take a deep breath. But look at this question C. It said, raise the head of the bed. The first thing you need to do is to raise the head of the bed. Because when you raise the head of the bed, it makes breathing easier and better. Now you can tell the person to take a deep breath. Taking the vital signs, yes, it's possible that you take the vital sign when the nurse asks you to do so. So the right option here is raise the head of the bed. It makes it easy to breathe better when the head of the bed is up. Question number 2. A resident who is wearing a hearing aid keeps asking the nurse aide to repeat information. Which of the following actions should the nurse aide do first? What is the essence of a hearing aid? The hearing aid is used to hear better. So when your patient is not hearing better, even with the hearing aid, what do you think that is going on? Now he said, what will you do first? Speak loudly and directly into the hearing aid. Check that the hearing aid is in correct ear. Ask when the hearing aid battery was replaced. Make sure the hearing aid is turned on. Now, which one is the correct answer? I hope you will get this right. So the answer is D. Make sure the hearing aid is turned on. Let's go back to that question. This is somebody who have hearing aid, and she's wearing the hearing aid. So if this person is not hearing you, the first thing you need to do is, you need to ask yourself a question. Miss Jones has a hearing aid on, but she's still not hearing you. That means something is wrong with the hearing aid. If it's not hearing aid, probably the Miss Jones' ear is, getting bad. So, but there is no way you will know if the ear is the problem. But at least for the hearing aid, we want to make sure the problem is not from the hearing aid. So the first thing you need to do is this hearing aid turned on? Look at it, check it. If it's on and Miss Jones is still not hearing you, check if there is earwax, something blocking the hearing aid. Let's assume it's clean. Maybe you need to check the battery. Maybe the battery is dead. These are the things we need to do as a CNA. B says check that the hearing aid is in the correct ear. Yes, it is in the correct ear because Miss Jones knows where to put the hearing aid. And again, it didn't say in the question whether the person has one hearing aid or two hearing aid. So that shouldn't come in here. So hearing aid probably is for both ear. So the answer is check that hearing aid and make sure it's turned on. Question number 3. The nurse aide is bathing a resident and noticed new swelling in the resident ankles. Which of the following is the best, again underline, best response by the nurse aide? The patient has swelling. Which is the best response by the nurse aide? As if the resident has been eating salty foods lately. Yeah, I know maybe salty food, can make somebody retain fluid. But is it the best response when you notice that your patient has swelling on the ankles? Elevate the resident legs and check again later. Report the swelling to the charge nurse. Okay? Avoid bathing the resident's lower leg. Anyway, elevate the resident leg and check again. Yes, if this patient's leg is swollen, one of the interventions could be to elevate that leg. Elevate the leg. Yes, that's a good thing. But is it the first thing you need to do? This is something the nurse will tell you, okay, when you put Miss Jones in bed, please elevate that leg. But nurse need to know. Is that not true? The nurse needs to know that Miss Jones' ankle is swollen. Then the nurse has to assess and know the problem with that leg. And one of the interventions might be to elevate the leg. But the first thing and the best thing you need to do at that moment is report that swelling to the nurse. Question number 4. The care plan requires that the resident be ambulated 100 feet twice a day at 10 and 2 p.m. When the nurse aide arrives to walk the resident at 10 a.m., the resident refuses. Which of the following is the best response by the nurse aide? Remember what we're saying here is about priority questions. Maybe you can plan to walk a little further this afternoon. The doctor ordered your walking exercise. You really need to try. You have the right to refuse. Do you want me to tell the nurse? Will you prefer to walk a little later? If you look at these options, all of them seems like they are good, but there is one here that is the best option. When you go to your residence, it's supposed to be twice 10 a.m. and 2 p.m. At 10, the resident refuses. First of all, you want to make sure that the person, why is she refusing? Is it that she's tired or she wants to do that later? You try to find that reason Ms. Jones is refusing to work at that time. Give her, okay, can I come back, Ms. Jones? Maybe it's too early. I think that would be the best option. I know, so many people will do that. They say you have the right to refuse. Do you want me to tell the nurse? That is minus one tax for you for the day. But I think the best thing to do is offer that patient another time. Try to find out why she refused. Maybe it's too early for her. Maybe after that breakfast, she was so tired. So D will be the best option. Another thing you have to have in mind is resident safety when you are answering questions. Safety is everyone's concern. Some other individuals may not realize that some activities may be harmful to them, and that put the resident at risk for fall. think about safety when you first enter the resident room and think about safety when you leave that room. When answering questions, put your resident safety in mind, and that should be of a high priority. Let's take question number 1. A nurse aide walks into a resident room and finds the resident on the floor. The resident says, "I fell down and I cannot move my arm." What should be the nurse aide's next action? Help the resident to a sitting position on the floor. Ask the resident to stay still while the nurse aide calls for help. Ask the resident to describe the pain and how the fall happened. Support the injured arm by placing a pillow under the arm and shoulder. I hope you will get this one right. The answer is B. Your patient was on the floor. You don't know the injury, what kind of injury that person has. When you see your patient on the floor, you don't want to move that person until the nurse assess the patient. So the best option here is call for help. Call your nurse. Let the nurse know that Ms. Jones is on the floor. After the nurse assess this patient, then you take instruction from the nurse. So the answer is B. Ask the resident to stay still because you don't want to move this patient. Because if she has fracture, moving that person can cause more harm. So let that person stay still until the nurse arrives. A nurse aide enters a room to help the resident to the bathroom. A trash can in the room is on fire. What should the nurse aide do first? Remember, we are talking about safety. Safety. The previous question, this is number 1. You want to maintain the safety of your patient by not moving her, because moving her could cause more damage, more harm. Now you walk into your patient room, the trash can is on fire. What will you do first? Remove the resident from the room. Even if you don't know what to do here, remember the response to fire emergency acronym, RACE. That could help you answer this question. But with the safety in mind, the first thing you need to do is to what? Remove your patient before any other thing. But let's see what the options are. It says use the resident pitcher of water to put out the fire, open the window to allow smoke to escape, yell fire along with the location. Well, the answer is C. Remember, we're talking about safety. When you remove your patients, then any other thing will follow. Now we come to therapeutic communication. Remember, we are working with residents, working with the co-workers, employers, family members. We have to learn how to communicate right. Communication is the way we exchange information with others. It is the basis of our interpersonal relations. Communication is an important part of the care that we give. When we talk about therapeutic communication, it is the face-to-face process of interacting that focuses on advancing the physical and emotional well-being of a resident. The goal of therapeutic communication is to encourage the residents to discuss their feelings. Now, let's take this question. Remember the goal: to allow that patient to talk more about what is bothering them. A resident whose husband died a few years ago says, "I have got to get dinner started. My husband will be home from work soon. What is the best way for the nurse aide to respond? This resident husband died a few years ago, but today he's telling you she's going to prepare dinner for the husband. Offer to work with the resident to the activity department's kitchen. Oh, okay. So that she will start preparing dinner for the late husband. B says, remind the resident that the nursing home prepares her meals. Does he prepare the resident meal or the husband's meal? I don't know which one. Ask the resident about her husband's favorite dinner and explain gently that the resident husband is dead. That is the worst thing you would do. Telling her that the husband is dead. Then you will be there facing arguments. Remember what we said earlier, therapeutic communication. You want that person to talk about the husband or the dinner. Encourage the person to voice out their concerns, what is bothering them. And in this question, it is about the husband and the dinner. So you say, ask the resident about her husband's favorite dinner. Therapeutic communication. You don't want to tell this person that the husband is dead or take her to the kitchen to start preparing dinner for the late husband. I don't know who will do that. Encourage that person to talk about the husband or about the food that she prepares for the husband. Another question. A resident tells the nurse aide about being bored. The resident says, my days seems to last forever. What should the nurse aide do? Tell the resident, I know what you mean. My days seem too long. Ask the charge nurse if the resident can have some medication. Ask about activities the resident has enjoyed in the past. Tell the resident to check the activity schedule. What option do you choose? I hope you will get this right. The resident is telling you that she's bored, and you're telling the resident that you are bored too. That's right. Ask the charge nurse if the resident can have some medication. Medication for what? For boring? Or medication so that the patient will not talk? Or medication that will keep the person activities going or something? I don't know what kind of medication that the nurse is going to give here. Ask about activities the resident has enjoyed in the past. Remember the goal of therapeutic communication. Any option that encourages that resident to talk more about the issue at hand is the correct answer. So in this question number 2, the answer is C. Ask about activities the resident has enjoyed in the past. Another thing we need to have in mind also is to avoid asking yourself what if in your questions. When you are presented with a question, make use of the information in that question. Stop asking what if. What if? And again, some of the students have experience with home care. Please forget what you normally do with your patients or residents or clients. It is not the same thing when it comes to nurse aide in a long-term care facility. Now, avoid what if when answering questions. I repeat that. And make use of the information on the question. Let's take this question. I think maybe we'll answer our question. A nurse aide noticed that a resident with dementia is walking with a limp on the right foot. The nurse aide's first response should be to return the resident to bed, provide the resident with a cane, tell the nurse the resident is having foot pain, remove the resident's shoe and inspect the foot. Right. So, return the resident to bed. What would be your reason? Your reason, is it because the person maybe is joking, is playing, because you know she has dementia, so she can, maybe she's joking, right? Now you provide the resident with cane. Why? Because she's limping. Also, what is causing that food? What is the problem with the food? Why are you giving the person cane? Oh, because she has pain. What if? Tell the nurse that the resident is having foot pain. What if? How did you know? Did the patient tell you that she's having pain on her foot? Or you think Miss Jones, because she has dementia, she can come up with anything? Remove the resident's shoe and inspect the foot. If, let's say, assume your child comes from school with that foot limping on the right foot, I know the first thing you will do is to ask, what happened to your foot? You take off the socks to see first. When you take off Miss Jones' socks to see, maybe Miss Jones is joking, or maybe something is actually wrong. Then you have, you tell the nurse that, okay, Miss Jones is limping on her right foot, and I look at it, she has this or that. I don't have much question on this, but I can tell you some of the scenarios. Maybe you have a question that says, Miss Jones, let's assume, in the dining room, Miss Jones refused to eat. You came to pick up the tray. You noticed that the food, Miss Jones didn't touch it. You didn't bother to ask Miss Jones what is going on. You didn't bother to know why she didn't eat the food. You take the tray. Oh, maybe the family brought food for her. Maybe she didn't like it. That is what you assumed. But you remember that this person, probably the food wasn't placed on the table where she can see it. And now you assume that she didn't like the food. Anytime you are answering questions, please remove what if. I get these kind of things from my students sometimes. When they are asked questions, they say, but what if? What if? What if what? Did you see all that information in the question? Please make use of information on the question and stop asking yourself, what if? I hope this little test-taking skill will help. And if you like it, share and subscribe. And again, this is part 1. The next one, on part 2, we'll go over a couple of questions, and then we'll, decide. I will break it down for you how to answer questions. Some people are failing their written exams because of test-taking skills. They don't know what to choose when they comes to 1 or 2 questions that are alike. I hope you like this little tutorial. If you like it, subscribe and give it thumbs up. Thank you.